Good afternoon. It's great to be in Northwest Florida. Last time I think I was here, we did the airport money, so that's going to be good. We want to come back many more times to do more economic development, particularly as we start to move forward and really get our legs back underneath us. One of the things that we've stressed from the beginning was diagnostic testing, particularly in areas that we're seeing big outbreaks. Fortunately, Northwest Florida's done a lot better than some other parts of the country, but we've put a lot of emphasis on that. So at this point, we have tested, we've gotten over 403,275 tests completed in the state of Florida. So New York has the most tests. I believe California's second, and then we are third, and so we're going to continue to do that. But as you go into phase one, a lot of people, including me, believe that we need to have testing readily available. As people start going back to work, if someone goes to work and the employer wants them to test, you need a place to do that. And I know they've done a good job at the hospitals here, and there have been other things, but we want to make sure that we have as many opportunities for testing as we possibly can. So that's why we're here today. We are going to have, this will be the 10th drive-through testing site in the state of Florida here at the University of West Florida softball complex. It is essential that we identify cases as they come up. You have places like Northwest Florida that's a lot different than a New York City or a Chicago or some of these other places. But if you see a cluster develop, we use testing, and then we can go in and isolate people so they don't affect other people. So it's very, very important to do it. So this is going to be a 2-lane drive-through. It'll be operated in partnership with the Florida National Guard, the Florida Division of Emergency Management, Escambia County, Santa Rosa County. And we will offer to start 400 tests a day. If there's more, we'll do more. I can tell you from around the state, we have not had enough demand to meet what we offer at all these testing sites. I think that's a good sign, because I think there's probably not people with symptoms who are trying to get in. But that is what we're going to do. If we need more, we'll do more, and that's going to be the true with all these different sites. We have done at all our drive-through sites around the state almost 100,000 tests already, and we're going to continue to do many more. In order to do this, I think it's just important for people to know there is no restriction. I mean, we're not doing minors without parent consent, but anyone 18 and up, if you have coronavirus symptoms, you could come get tested. If you're a first responder or law enforcement, which is what they're doing today in the soft open, you can come get tested. Even if you don't have symptoms, but you have some reason to believe that you may have been exposed to coronavirus, then you can come and get tested. And so it's meant to be broad, it's meant to cast a broad net, and we want to be able to identify as many cases as we can. This is our 10th drive-through. We're going to do additional drive-throughs throughout the state. We've got Miami Beach. We have Southwest Florida, Sarasota, Bradenton that are going to be on deck as well, and those are going to be very, very good. One of the things that we've done is do walk-up testing sites, because in certain parts of our state, particularly in some underserved communities, the drive-through site may not be enough. So we're doing these walk-up sites where we're going into areas that we think may be underserved and allowing people to be able to come walk up. So we've done 10 of those walk-up sites, and we've already done about 10,000 tests on those. And this is a concept that we kind of started within the last couple weeks. So we have a capacity to continue doing that. I'm also excited, and we'll have an announcement, official announcement, at hopefully the beginning of the week. But we have acquired a mobile lab for testing, and it's in an RV. And we want to drive that around the state of Florida, find places that need tests, and we're going to be able to do rapid testing with the mobile lab. So we can go to a nursing home, you can test the staff, you can test the residents, and you can have the results back within an hour. So that's going to be a really good thing for the state of Florida, and we'll drive that to where the important points are to try to be able to do it. If you look at what's been going on throughout the country, and what we've done, I think, better in Florida is the nursing homes and the long-term care facilities. We've done a lot. We did a lot at the very beginning, not just restrictions, not just requiring PPE. We have the National Guard that goes around to the nursing homes and does testing. We've sent out 7 million masks just to nursing homes in the state of Florida through the Florida Department of Emergency Management. We've sent out 1 million gloves, pairs of gloves, 500,000 face shields just for our long-term care facilities. And that's been something that has been very, very important. It's why our rate, fatality rate, and hospitalization rate for long-term care patients is so much less than some of these other states. So we're going to continue to do that. But I think that mobile lab really allows you to go, I try to identify any clusters before they spread and ultimately be able to save a lot of people. So we're going to continue to do that. These National Guard teams in the nursing homes, they've done 12,000 residents in over 80 facilities, residents and staff. What happens on this is at the very beginning, we put in a rule that said you have to screen the staff. They have a fever, if they have any type of symptoms, if they have been in contact with people that may have these same symptoms. And most of the facilities did a really good job. Some didn't follow. You had some sick people go in and there'd be outbreaks. But what we started to see is that you would have some facilities that followed everything, but the staff that would come in didn't have symptoms. They passed the screening, but yet they were infected. And the asymptomatic spread in these facilities caused a lot of staff members to get infected and then pass it on to residents. So by doing some of this testing, we're trying to identify that before it gets out of hand. But it's a very difficult problem, but it's one we've devoted an awful lot of resources to. But when you have them wearing the protective equipment, it does make a difference. It cuts down on transmission, the face shields, all of that stuff is very, very significant. We're also partnering with the private sector. I required our Surgeon General do an emergency order to allow licensed pharmacists to administer COVID-19 tests. And certainly after doing so, we're already seeing results to that. Both Walgreens and CVS are opening up testing sites. Walgreens just announced that they're opening 9 drive-through sites in Florida. And they're also going to have 7 with antibody testing. And I'm going to talk about antibody testing in a minute. CVS has also said they're going to open multiple sites. Walmart will have 5 drive-through sites across the state. They have a partnership with Quest Diagnostics. And so if you look at where the country was 2 months ago, and then you look at where many places are, and certainly Florida has been a leader in terms of this, you're going to be able to go to Walgreens now. Just remember how hard it was to find a lot of tests at the end of February, beginning of March. So that's a great thing, and we're going to continue to keep that going. Antibody testing is something that's very, very important. We're going to have hundreds of thousands of the antibody tests to be able to do seroprevalence analysis and to be able to test healthcare workers and first responders to see who has the antibodies. If you have the antibodies, then that means you've had the disease. And the thing about this disease I think we've learned about is there's far more people that have actually had it than have simply tested positive. You look at the Stanford study in Santa Clara, California. You look at Los Angeles County, University of Miami did one in Miami. And what they're finding is antibodies way, way in excess of the number of positive tests in a given area. So that means a couple things. One, it means there's some immunity in the population. We need to figure out how much. 2, if all those people have also had it, the hospitalization rate and fatality rate are lower than we initially feared, which is another good thing. And I think what the studies are showing is for people under 50 without any type of serious conditions, that this is very low risk for people. And so as we get people back to work, it's important to put people's minds at ease that in that cohort, which is the bulk of our workforce, it is very low risk. The risk gets higher as you get older, and the risk definitely accelerates as you have comorbidities, particularly people that have multiple comorbidities. But the antibody tests, we're going to do some representative sampling in different parts of the state and then take it. And if a healthcare worker has the antibodies, then they know they're going to be protected at least for some time from reinfection, which is a great thing. PPE has been very important, the protective equipment when you're testing somebody. If you're having a COVID patient in the hospital, you got to protect the staff. And we've pushed out millions and millions of pieces of PPE, but we also want to plan ahead. We're moving to phase 1 here in Florida. You've seen around the country, this thing has kind of peaked. We're now going in a different direction. We don't know whether there'll be a rebound. Maybe there'll be a rebound soon. Maybe there'll be a rebound in the fall. Maybe there won't. We don't really know. Nobody knows. So I think it's prudent to be prepared for these eventualities. So the state of Florida has just signed a long-term deal with Honeywell to receive 12 million N95 masks in order to respond to COVID-19. You remember, these masks were very difficult to come by. You had 3M being Defense Production Act. So this is prudent. This will allow us to obviously use them in the near term, but then prepare if there's a resurgence in the fall season. We want to have the PPE ready. They're going to be delivered on a rolling basis, and we will distribute them to first responders and healthcare workers statewide. Any masks that are not distributed will be stockpiled, and they'll be ready to go when needed. So since the beginning of this response, the state of Florida has sent the following amount of PPE: nearly 20 million masks, 10 million gloves, 1.5 million face shields, more than 1 million shoe covers, more than 400,000 gowns, 200,000 containers of hand sanitizer, almost 50,000 goggles, and 35,000 coveralls. So it's been the biggest logistics mission in the history of the state, not just with the PPE, but some of the things you see here with the testing. And I want to thank the Florida Department of Emergency Management for doing that. We also want to recognize that you may see a crunch in this PPE market again, and we should do our best to preserve the PPE that we have now. So I'm happy that we just received a critical care decontamination system from the federal government. This decontaminates masks using high concentration vapor phase hydrogen peroxide. So the system can decontaminate up to 80,000 masks per day and can decontaminate the same mask 20 times. So we'll be collecting and cleaning N95 masks from hospitals, first responders, and testing sites. This system is located at the community-based testing site at the Miami Hard Rock Stadium, and it'll be operated by trained personnel in conjunction with the Florida National Guard. If you look around the state at what's going on, we wanted to do the mitigation as a country. We've really never done it to this extent before in previous pandemics, but the fear was you needed to flatten the curve because if infections spiked, it would overwhelm the hospital system, overwhelm the healthcare system. That would obviously lead to excessive deaths and other negative health outcomes. In Florida, not only did we flatten the curve, we have more hospital beds available statewide today than we did when the pandemic began. In fact, as of last night, we had the fewest number of people for COVID in the ICU than we've had since the beginning of April. So those are good signs, those are good trends, but clearly we have not seen a surge that has overwhelmed hospital capacity. In fact, down in Broward County, one of the most hard hit, you have Miami-Dade and Broward combined. I think they represent over 50% of all the cases in the state of Florida. Memorial Healthcare, big hospital system, they just collapsed an entire ICU unit because they didn't have enough patients being put in the ICU. So the system has held. We obviously plan if there's anything that happens in the future, but we had thousands of beds ready to deploy. Many of these things were deployed around different parts of the state where we thought there could be a risk, but we just haven't seen that. We've been able to bend the curve, and the hospitalizations have been far less. In March, you had newspapers running articles saying that by the third week in April, Florida would have 465,000 people hospitalized because of COVID-19. Now that's a terrifying thing to tell people because we only have 70,000 hospital beds in the entire state of Florida. So just imagine if that had come to pass, you'd have hundreds of thousands of people that wouldn't even have access to a basic hospital bed. Point of fact, now we've got about a little more than 2,000 people hospitalized in the state of Florida for COVID-19, not 465,000 people. So they were a little off in that projection. but I'm glad that we were able to beat the projections and the experts by 463,000 hospitalizations. If you want more information on what's going on, we're sending out updates. Just text FL COVID-19 to 888-777. Again, FL COVID-19 to 888-777. I have Congressman Gates here, who's been working really hard for the people of Northwest Florida. And I know as we get into this phase 1 and continue to move forward, he's going to be there every step of the way supporting the people here. So I want to give him a chance to come up and say a few words.
Thank you, Governor. On March 29th, just about a month ago, a McClatchy reporter asked President Trump, how is it that the state of Florida seems to have fulfilled 100% of its requests for drawdowns from the National Strategic Stockpile? And President Trump was very candid. He said, look, Florida, they do a very good job. They're very aggressive at advocating for their people and for their positions. And Governor, in all the work we've done together, I've never been prouder than when the President acknowledges that our team working effectively to raise these concerns results in better care for our residents and our constituents. That work together has been bipartisan. Very early on in this process, the reason we're able to launch mobile sites today is because we got ahead of the game, and very early on in this process, I led a letter of the Florida congressional delegation that Republicans and Democrats signed on to that detailed out the specific things that would put us in a position to best respond to this crisis. And Governor, I was grateful that the Miami Herald was laudatory in their praise on the congressional delegation, but they criticized you, which was odd because it was your administration that actually built the lists that we used to go and get the stuff from the federal government for our hospital systems and for our frontline providers. And in that light,
do you have any reason why would that be the case? I just can't imagine why that would be the case. Man, we're going to have to get Inspector Clouseau out on that one.
I know you also feel a special kinship with our guardsmen and women who are here today. I recall serving with you in the Congress, and while some of us would return home for vacation as a consequence of your additional service to the country, you would go out and do drills. So I know you know the sacrifice they make to be away from their families and to be here serving our constituents. There are a few areas where the governor's work, the president's work, has aligned specifically to meet some needs in Northwest Florida, and I want to highlight those. Because we were able to get drawdowns on the front end, I could tell you that we had the CEO of Baptist Hospital able to get tests and swabs early, and he actually drove himself, Mark Faulkner did, over to Tallahassee to the Emergency Operations Center where you had coordinated testing on the front end that allowed us to be in a good position. I serve on the President's task force with the head of Ascension Healthcare. That's a major provider in our community. Also at the HCA systems that serve Okaloosa County, Twin Cities Hospital, and Fort Walton Beach Medical Center, they were having challenges with their providers of testing equipment and reagents. And Governor, it was your office, it was the Division of Emergency Management that got on the phone and actually created better connectivity so that the purchase orders of Northwest Florida hospitals would be met faster and that we got everything we need, and we were very successful in that. And then I would also suggest that the offense that we're playing in nursing homes and in long-term care facilities is uniquely important to Northwest Floridians. I could tell you, Governor, anytime we've had even the concern, even the whiff of this virus in one of our long-term care facilities, your Department of Health has been there on time, on target. I had one facility in the Twin Cities area that had like 3 and 4 visits from the Department of Health for triple and quadruple redundancy to make sure that we were getting accurate test results. I would finally thank you for your work with our local law enforcement. We got concerns early on from our sheriffs, from our police chiefs, that the migration of folks from Louisiana over to Northwest Florida could create a hotspot here that we would have to deal with. And when Sheriff Ashley of Okaloosa County called me to reflect on that concern, I immediately patched him into the governor, and in real time, the sheriff and the governor worked out the framework not only for a strong executive order, but for an enforcement regime that protected our people in Northwest Florida from that substantial potential risk. So thank you for doing that as well. The governor and I met briefly before, and there are a couple of issues in Northwest Florida that we talked about. The first is vacation rentals. In Northwest Florida, we don't have a 500 key hotel room every 1,000 feet. Because of our density that we have, we're more reliant on vacation rentals, and I'm confident that in the governor's evidence-based, measured approach, the same approach he took on the front end of this virus, that as soon as it is safe and appropriate and we enter new phases, that the governor will work with our local communities to open vacation rentals. Here is my advice to our counties and to our cities. If there are particular areas of advice or concern that you have, I would strongly encourage you to meet about those, discuss them in public, even pass resolutions regarding the conduct that you think our community is ready for. Throughout this entire process, Governor DeSantis has leaned heavily on the expertise and on the local knowledge of our local leaders. I've been in contact with our mayor about not only the health conditions, but the economic conditions that we want to make sure that we really bolster in the coming weeks and in the coming months. And I know Mayor Robinson would always say it's good to have a Navy guy like Governor DeSantis here in a great Navy town of Pensacola. So thank you for that great work, Governor. I know we've got a lot of essential work ahead on the President's task force for myself and with your task force, but we know that the brighter days for Florida are ahead of us.
Well, thanks, Congressman. And in terms of some of the monitoring, in terms of the travelers, we had, so you had the outbreak in New Orleans, which was really bad. Obviously, the outbreak in New York City was terrible. Incidentally, I mean, a lot of these people 6 weeks ago was saying Florida was going to be just like New York. If you look at the numbers, we have 2 million more people than New York. They've got about 20 times the number of fatalities than we do. The hospitalization rates couldn't be more dramatic. So those people were just wrong about Florida, and we've done much better than all those people said we would. But we knew it was a problem when you started to have people fleeing these shelter-in-place orders, and they're flying to Florida from New York. We're worried about New Orleans, so we put in really good screening processes, and we're self-isolating and quarantining people who were coming in from the hot zones. I can tell you that had a good effect. We would have had a bigger outbreak had we not done that. And that's obviously true for the New York travelers, but if it weren't for the people of Northeast Florida acting early, coming to me, saying that we had an issue, they acted early enough that we were able to really, I think, totally keep it at bay. And that would not have been the case had we just let it loose. So it's very important. Another thing I'll say before I take a couple questions, I announced today on Monday as part of phase 1, we're going to begin doing our state parks so people can go. Now, there's obviously going to continue to be social distancing. We don't want to have big crowds, but if you're going out there with your family, that's a healthy thing to do. One of the things we wanted to do this whole time is really focus on what the science tells us, what the experience in different countries, in different states has showed us. And there was a great study that was done by our Department of Homeland Security. They have a biodefense center, and they analyzed how the virus reacts under sunlight, heat, and humidity. And they determined that if a virus is on a surface in direct sunlight and heat and humidity, the sunlight kills the virus quickly. They also looked at how it would be airborne with aerosols or droplets, and they made the same determination that this virus does not like the sunshine, does not like heat, does not like humidity. And so that informs us to say, you know, you go out to a state park, or you go out and do things that are productive. As long as you're not in big groups, that's very low risk. Certainly more risky going to some of these grocery stores where people are crowding. So let's use this to our advantage and follow the science. I hear Jacksonville allowed people to walk and run on the beach 2 weeks ago. And you heard all these howls from the Northeast media. You know, these are the same people. They have subways running in these cities, which are very dangerous, but yet they're upset about Jacksonville, and they're saying all these things. You look 2 weeks now, we're here, Jacksonville has had their cases decline. Hospitalizations have declined. That's a low-risk environment. And so we're going to continue to support activity like this that's low risk. Our parks are one of those. It's very important that we're able to do it. And the final thing I will just say is we really want Northwest Florida to be a big anchor for us going forward. As we move into phase one, I wish I could just flip a switch and say we're just going to be able to do it, but we've really got to be very methodical about it. We've got to be careful and prudent. And part of the reason is the country's never been through something like this before. If you look at the 1918 pandemic, 57, 68, they never did a national shutdown. And I tried to do it here in ways that I think mitigated damage. But nevertheless, I mean, this is what happens with the country. So as we come out of this, the virus isn't going to go away. Clearly, we have hospital capacity, and our positivity rate on tests is incredibly low. You have places around the country where out of everyone who tests, you'll have 35 or 40% that'll test positive. In Florida, in the last week, it's been between 4 and 6% test positive. Everyone else tests negative. So that's an incredible ratio, but that's an indication that you don't have real rapid expansion of the virus like you would in some of these other hotspots. But as we come out of it, we want to continue to be smart about how we're acting. This virus tends to thrive when you have large groups of people together, and usually indoors in a climate-controlled environment. But if you put 100,000 people outside, that would be risky too, even though the indoors is more risky. But if you look at these super spreading events, there was a funeral in Albany, Georgia at the beginning of March, and you had people packed in, everyone was crying, hugging, kissing, and this thing, you had a super spreader, and it just took off. It infected dozens of people. It led to a number of deaths just from that one event, and it continued to spread throughout the community. You look at the Biogen conference in Massachusetts. These are people at a business conference. They're together in close proximity, talking. Someone coughs, you're right there. Sustained contact. A lot of people there got infected. You look at these cruise ships or the Navy ships. When you're in the confined environment for a repeated amount of time, it tends to spread. So those are the things that you really got to look out for: the close contact and the enclosed environments. If you're not having close repeated contacts, then you really are doing a lot to protect yourself. And so particularly when we look at our vulnerable populations, our elderly, and those with significant underlying conditions, it's important that they obviously heed the call, which our seniors have done a great job. I mean, they've listened from the beginning. But it's also those of us who are not in those groups, make sure that we're acting in ways that are not putting those folks at risk. I mean, our order for May 4th is for folks in those groups to continue to stay at home as much as they can and avoid close contact outside the home, and that's the right guidance. But I think we all can play a role in making sure things are good. So we have responsibilities going forward. If we go forward in a responsible way, I think Florida is going to bounce back quicker than anybody. But we've got to be responsible, and we've got to be cognizant of what's going on around us. Okay. Yes. Well, I'm going to look at it. It's the first time I've known about that, but that's obviously not what we want to see. So I'll look at it. I can't off the top of my head because they're visiting so many, but basically what we do is if there's a need and someone sends a demand signal, then they go. And I think it's been very, very successful. If you can identify a staff member that's infected, then you can figure out who else they may have passed the virus on to, and that's very, very important. if you have one asymptomatic staff member, just by the nature of being in those facilities, you're in close contact with people, and it's tough. So we want to try to identify that and then isolate the people. Yes. So they're sent to a variety of different private labs, some state lab. Some of these private labs get really backed up. So if we send something to, what are they, LabCorp or Quest, we're supposed to get a decent turnaround, but what happens is sometimes it'll back up. If you look at really the last 2 weeks, if you look at the test results, I mean, the positive cases in Florida have been, for 22 million people, very low, like 500, 600, 700. There have been, I think, 3 or 4 times where you've had it as 1,000, and then you look at the number of results, it's like 15 or 20,000 results. So it gets backed up, and then they dump a lot of results. They did a result dump, I think, for yesterday, where we had 21,000 results just come in. The day before, we only had 9,000, I think, results. So this is kind of just what's happening with the back. But what we've done to cure that is once the federal government upped the amount that they reimburse for tests, it was $50, now it's $100 a test. That has unlocked a lot of lab capacity because it wasn't economical for these labs to do it at 50. It is economical at 100. So we have a contract with a couple labs to do high throughput testing, total of 18,000 tests a day on a 24 to 48 hour turnaround. So that's what we want to see so that you can get those results back. Now, our RV, where we're going to have the mobile lab, that's going to have the Cepheid point of care test. So that's a 45-minute response for each test. And as people come in, you can put a number of the cartridges in at one time and then get a result. So if you're talking about a long-term care facility, that is phenomenal. As we get more and more supplies, one of the things I'd like to do is be able to offer testing to family members of long-term care residents, because these residents haven't been able to see their families in almost 2 months. And so if you have rapid testing, you can have a son or daughter go in, test. If they're negative, then they can go see their mother or their father. And I think that would mean a lot to people. We've got to get more of the rapid tests. We have this contract now with Cepheid, which I think is $3,500 a week. But you also have Abbott Labs with a rapid test, and there's more and more being developed. There's a saliva test. There's a home test. So I think as we go, every week there seems to be more and more options on this stuff. We obviously don't want people going in who are sick, of course, and we've put a lot of restrictions. But a lot of times when these restrictions are done, people don't think about the negative consequences of that. It was necessary to do it, but it was not cost-free. And the cost was you have residents there who don't have the interaction with their families that they would like to have. So if we have the capacity to offer some tests to those families, or if they have antibodies, then I would like to see us be able to offer at least some limited visitation. I think it would mean a lot to the residents. Yes, sir.
So you've got increased testing, which would presumably lead to more positive cases, and at the same time you're reopening, partially reopening restaurants, et cetera. How do you differentiate between those two?
So what I tell people is pay less attention to the number of positive cases and more attention to the rate in which those are coming back positive. In other words, if I test 10,000 people and I get 1,000 positives, that is worse than me testing 20,000 people but getting 1,100 positives, even though there's more positives. It's because I'm testing more people, the positivity rate is down, and I think what we're seeing in the testing recently, as we've been able to expand the criteria. Initially, you had to be really sick per CDC guidelines. We got away from that as soon as we could to try to expand it. So what'll happen is you may have people that have no symptoms or mild symptoms come in, and maybe some people will test positive. That should be viewed as a good thing because we're identifying people who were going to carry this thing anyways, and at least you can have them self-isolate and not infect other people. So I definitely think if we're doing 25 or 30,000 tests a day, look to see what percentage positive. We have one of the lowest percentage positives of any major state for sure. The national average, I think, is about 18%. 18% of all people that test come back positive. In Florida, we're down to, with our new cases, we're probably down to about 7.5% over the last few weeks. But this last week, we're probably close to 5 or 6%. That has gone steadily down. So that's a really, really good sign. Some of our best testing days in the last 2 weeks have actually had more cases than the days before and after. But we had so many tests reported that you see that the positivity was very, very low. So our touchstones going forward are really going to be the touchstones that brought us to do the mitigation as a country to begin with. What is the stress on the hospital system? Are there available beds? Are we in danger of overwhelming the system? And if we continue to have capacity, then that means that this thing is being kept in check. If you have low positivity, again, that's another indication that things are being kept in check. When New York City first flared up, they had 60% of the tests were positive. And even now they've had a big decline, but they're still, I think, between 25 and 30% of all tests are positive. New Jersey, I think, is 45%. So when you're in that single digits, that's a really, really good place to go. And as you're expanding testing, yes, you are going to find additional positive results. But if you're doing it in a way that's broad-based with a low positivity rate, then that means things are going in a good direction.
Governor, I wrote you a letter in March thanking you. You've done an excellent job about understanding that Florida is different. And I'm going to pass it on to the League of Cities and continue to commend you for that. As we're moving forward into recovery, we appreciate your step-by-step prudent plan of moving forward. Obviously, not all of us are going to be experiencing the same thing. There are things, cosmetology, those kind of things that we would like to see. If we're continuing in a green sense where there's no problem, can we begin to move forward on some of these things locally as we do and what we have here? Local conditions warrant us doing that.
Yeah, so what we did for phase one was the White House came out with gating criteria to get into phase one. The state of Florida as a whole satisfied the gating criteria. We had a 14-day downward trend in influenza-like illnesses, 14-day downward trend in syndromatic emergency type visits where people had the COVID symptoms. We also had a decline in positive cases on a trend of 14 days, but really, or you need a positive trend or a downward trend in positivity, and we definitely had that. I mean, we had that very strongly. And then you have to have your hospital system able to provide crisis care. So we had that statewide, even including Miami, which is almost 40% of the cases. But when we went to phase one, I spoke with Southeast Florida. They want to get there. They are trending in a good direction, but they wanted just a little bit more time. So I had the rest of the state go. And so I wasn't going to let their condition hold back Northwest Florida. As we go forward, I really think most of the state outside of Southeast Florida is all going in the same basic direction. I don't see a huge difference between Northwest Florida. I just came from Jacksonville. But I mean, you look at like Orlando area, I mean, they've done fantastic. So I think the rest of the state will be ready to go, hopefully, to phase two if the trends continue. But if we do have a situation where Central Florida is much different all of a sudden, and North Florida keeps going in a good direction, then obviously I would want to do that. I don't think I'm going to have to, though, because I think the trends are good in those other areas. And I do think that Southeast Florida is going to be able to get on track. It's they're an important part of our state's economic engine. We want to be very deliberate and careful with moving forward there. And we've been working together with those three counties throughout this whole time. So we'll continue to do it. But clearly, one of my mantras was, Miami was shut down 6 weeks ago. People were saying, the panhandle was a different situation, so you deal with them differently, and that's what we've tried to do from the beginning. I'd have to look at that. I wasn't aware that was going on. So let us take a look at that, and we'll get back to you guys. All right, thanks. It's great to be here. Yes, sir. Yep.
Touching on this lab here locally and similar labs set up around the state, what can residents expect as far as getting results and timeline? How long do they have to wait?
So if we're doing these labs that we've contracted with, It should be quicker than what they're used to. I think there have been times here where people have had to wait a week. That's obviously not what we want. We want to be able to turn this around in 24 to 48. That's what the contract says. But, you know, these other contracts said that too, and they got overwhelmed. So I just want people to know this is a new system we're doing with these big labs. I think it's going to be an improvement, but this is something we're just going to have to troubleshoot along the way. But clearly, the earlier you can get the result, the more meaningful it is. Because if you're an employee somewhere and you test negative, then you know you're okay to go back to work. If you test positive, then you can self-isolate, and then the health department can start figuring out who you had contact with. So the timing is important, and the sooner we can get it, the better. One more.
Yes, Governor. We're talking about the foreclosures, but I've known some people during this epidemic have been evicted also. I mean, during this time and stuff, and I thought there was some protection.
There was. I mean, we suspended evictions, and if people haven't been following our order, then they should contact their congressman, their state representative, and then they can bring it to the attention and work it through our office. I mean, we obviously put that in order to give people a reprieve. It didn't mean that they never have to pay their mortgage again. We were very clear about that. But just given these circumstances, you may have had people who all of a sudden, if the economy stops, they didn't have the ability to put food on the table. So we wanted to be doing things that recognize that hardship and weren't compounding it with things like that. So I would just tell people, if you've been in that situation, contact some of your local legislators, give them the details. They can then work with my office, and then we can see. But all folks are expected, particularly in that realm, to be complying with the executive order. Thank you. Which way?